There's a new class of drugs that could be a game changer.
These GLP-1 drugs.
Ozempic and Wegovy.
What is Ozempic, and why is it such a hot topic at the moment?
Oh, what a fantastic question. Ozempic is one of a new class of weight loss drugs. They are so-called GLP-1 agonists. GLP-1 is a natural, normal appetite-suppressing hormone in our body, but the pharmaceutical industry found a way to package a drug in a way that leads to elevated levels of this natural appetite-suppressing hormone in our body, such that it suppresses our appetite. And what happens when we don't eat as much? We lose weight. And the reason why there's so much hubbub about these drugs is that these drugs, in general, cause 3 times as much weight loss as all other previous classes of weight loss drugs, which we've had around for a half century. And so previous weight loss drugs be very rare to see more than 5% average weight loss, whereas these drugs, you can see like a 15% average weight loss. And so we have lots of examples in the past of drugs that were purported to be weight loss wonder drugs, only later to be pulled from the market as public health threats years later when we realized their downsides. And most drugs have been pulled from the market for causing too many side effects. But in that case, I mean, they didn't even offer much benefit. So even if these drugs turn out to do horrible things to people, it still might be beneficial to take them, just because obesity so dramatically decreases one's lifespan, reducing life expectancy as much as 6 or 7 years, that, like bariatric surgery, these drugs should be considered as last resort for those unwilling or unable to treat the cause of their obesity, which is a fattening diet. The problem is people eat too much crap. And so anything that gets people to eat less crap can be beneficial, whether it's, rearranging your digestive organs in bariatric surgery, or injecting yourself with a drug every week. But you don't need an expensive drug to decrap your diet. There's a range of common side effects, mostly gastrointestinal, like nausea, vomiting, constipation. There are some more serious, rare side effects, such as pancreatitis, gastroparesis, a slowing down of the digestive tract, such that can lead to bowel obstruction, which is a surgical emergency. Thyroid cancer is a rare side effect. But if you're worried about cancer, you need to be worried about having excess body fat, as obesity is associated with a wide range of cancers. One would expect with a sufficient weight loss that no matter how much cancer these drugs would cause, you would decrease your risk of cancer overall. For example, those undergoing bariatric surgery cut their cancer rates in half because, again, the inflammatory mediators spilled out by excess body fat can facilitate the growth of a variety of different cancers. Taking these drugs for a few years, you'd be expected to lose enough weight that would actually decrease your risk of a subsequent cardiac event by 2 or 3%, which is similar to what you see with kind of statin drugs, cholesterol-lowering statin drugs, which on an individual basis may not seem like a lot, but on a population scale could save thousands of lives. After about a year on these drugs, no matter how many subsequent years you continue to inject yourself, you don't lose a single more pound. After about a year, weight loss plateaus, but not plateaus because you're at a normal weight, but it plateaus because it no longer stops. It basically stops working. Your body fights back in terms of ramping up your appetite such that you're only eating about 400 calories less. And because you're so much lighter, because you took the drug for a year, it costs about 400 calories less to exist. And so with calories in equals calories out, your weight loss stalls. And so then you're injecting yourself with these drugs every single week for the rest of your life just to maintain that initial weight loss. And so you are less obese than you were before, but you're still obese, and you're not going to budge from that taking these drugs. And of course, you stop taking these drugs, all the original weight will come back, and then you'll just go from less obese back to more obese. So it really doesn't treat the underlying cause, which is why it's so important to the diet and lifestyle component is so important. If, however, you absolutely refuse to eat healthier, then these drugs can, in certain cases, be life-saving.
Ozempic, which is all the rage right now, which is absolutely taking a different approach to this whole issue of obesity.
So one of the scariest things in healthcare is the fact that we never address the cause. And don't get me wrong, I know that obesity is probably one of the number one factors in terms of like increasing all causes of mortality. So obesity is definitely something that we need to address. And especially when you consider 75% of Americans are either overweight or obese. Okay, so like I'm on the same page with you. Like we need to figure out what is the issue with this obesity crisis. But at the end of the day, this is another Band-Aid. And it's not even a Band-Aid. This is sort of taking sugar and expecting taking sugar with mercury and expecting not to be poison. And the reason why I say it is because of this. It's not necessarily the weight loss, losing the weight, that is the most profound impact on your health. It is actually the process. And what I mean by that is the process by which you go through losing the weight in a healthy way. That is actually what gets you all the health. Eating properly, all the nourishment that you have to eat during that period of time to lose weight, that's a huge part of it. The exercise that you have to do, that's a huge part of it. But what people aren't considering is that when you take a drug like Ozempic or Wegovy or Mounjaro, the unfortunate thing is you're skipping over all of those natural benefits by going through the process. And the other unfortunate consequence is all drugs have side effects. And drugs like Ozempic have huge side effects that they're not really diving into when they're talking to patients. And so they're putting all these patients on these drugs. And I did a post about this, and the post got over 8 million views because many of the side effects people just weren't aware of, like the gastroparesis, which is the paralysis of the stomach. That means that when you eat your food and it goes to your stomach, it literally does not release the food into your small intestine. So your stomach becomes paralyzed. Okay, so that's a side effect. Pancreatitis, okay, which is an inflammation of your pancreas. And everybody knows that pancreatic cancer is by far one of the most aggressive cancers, okay? Also, gallbladder issues, so cholecystitis, gallstones, blocking your bile duct, which is a huge issue as well, too, leads to a lot of digestive issues, blood clots like DVTs, deep vein thrombosis, that happen in the lower leg, but can dislodge, and that clot can end up in your lungs and cause a PE or pulmonary embolism, or end up in your brain and cause a stroke, okay? Kidney failure, blindness, okay? And most people don't know that 40 to 50% of the weight loss isn't fat, it's muscle. So 40 to 50% of the weight loss is coming from muscle mass. And then the worst side effect is the fact that Ozempic has a black box warning from the FDA. Now, I'll go on the record and tell you, like, people have heard me say on plenty of occasions that the FDA is simply not doing their job. Okay, when it comes to protecting us from food, and when it comes to protecting us from drugs, okay? Now, with that being said, this drug has a black box warning, which means that that is the highest warning that they could give you for a drug. And that black box warning says that this drug could cause you to have thyroid tumors and thyroid cancer, okay? So when we look at the risk versus the reward, at the end of the day, with all of that list of potential side effects, you have to ask yourself, is it really worth it? And to consider that the vast majority of people who, after they stop taking either of these drugs, gain most of the weight back, if not more.
I think the new meds are pretty interesting because it's such a dramatic example. You got a patient, morbidly obese, sick, right? And this 25-year-old Instagram person is going to blame that person. It's their fault. They have no willpower. Now, that patient takes a shot, and instantly the weight comes off, right? Instantly, the food noise goes away. Instantly, this shot is giving them willpower. That's what it's doing. All of a sudden, they're not eating that much. All of a sudden, the weight's coming down and they're getting healthy. All of a sudden, it's easier to get to the gym and they're going to the gym. And their whole life is changing from one little shot once a week. And that's doing all that. Now, the other interesting thing is they're taking that shot. All of a sudden, they got willpower by this 25-year-old standard, right? They're going to the gym. They're losing weight. Things are going great. And we trick them. They come to pick up their meds and we give them a placebo. Now they're doing a placebo shot. And all of a sudden, their weight's starting to go back up. All of a sudden, they're like, oh my God, I need to eat that candy. I know I shouldn't, but I'm going to eat it. All of a sudden, they've lost their willpower. It's not willpower. It's not the cerebrum, which is the thinking part of the brain that has willpower. It actually is based in the very primitive parts of the brain, the central brain, the neurocortex, the parts of the brain that control breathing and that control heart rate. Those are the parts of the brain that control hunger.